Medicare is a promise, and we will honor it. A Romney-Ryan administration will protect and strengthen Medicare for my mom's generation, for my generation, and for my kids and yours.
Vice presidential nominee Congressman Paul Ryan says the biggest threat to Medicare is Obamacare and that the Romney-Ryan ticket will put a stop to that. But could seniors fall through the cracks if the president's health care is dismantled? Joining us now for a fair and balanced debate are Democratic Congressman John Garamendi and Republican Congressman Mick Mulvaney. And we understand that Congressman Mulvaney may be having some audio trouble. So, Congressman Garamendi, let me start with you. The Republicans' biggest criticism has been recently that the new health care law moves $716 billion out of Medicare. Is that a fair characterization?
Well, the question is, what does it do with the $716 billion and where does it come from? Most of it comes from the insurance companies that have been receiving an unnecessary bonus for the Advantage programs, and the rest of it comes from waste, fraud, and abuse that is in the Medicare system. The other question is, where does that money go? It goes right back into benefits for seniors and for others. And the law specifically says not one nickel can be taken from the benefits themselves. Every benefit is guaranteed. Furthermore, these are not my words. These are the words of the AARP that says the Ryan-Romney Republican budget actually will end the Medicare guarantee for seniors now and into the future.
Congressman Mulvaney, if you can hear us, I want to bring you into this conversation as well. How do you respond to charges by the Democrats that essentially what Congressman Ryan has proposed in his plans, and I know that those are being worked together. He's not the top of the ticket. Ultimately, Governor Romney will make decisions and issue policy on his own on where he stands on some of these Medicare changes. But there's a lot of attention to what Congressman Ryan's plans have been so far and the fact that they will, quote, wind up hurting seniors by taking away Medicare as they now know it.
Sure, and I can't hear now. Thanks, I apologize for that. What you've just heard, and John, it's good to see you again, what you've just heard were the attacks that were on the original Romney plan in 2011, not the plan that he offered in 2012. Remember, he got together with Senator Wyden to come up with a bipartisan proposal that changed what Mr. Garamendi was talking about just a second ago. And the new Ryan proposal that Mr. Romney has adopted also keeps traditional Medicare on the table as an option for everybody. So to come back and say, look, the AARP is against it, that was from an older plan, it changes Medicare as we know it, that's from an older plan. You know, in this business, we get to sort of choose what we fight against from time to time, and the Democrats, including Mr. Garamendi now, are sort of attacking something that is no longer on the table. And that's unfortunate, because we need to have the debate. If there was one thing I agreed with wholeheartedly with Paul when he gave his speech in Tampa, is that we absolutely have to have a real debate about this, and we welcome it. But we can't sit here and fight at straw man and argue about proposals that were made 4 and 5 years ago.
Congressman Garamendi, what do you make of the fact that there is something bipartisan, or there was at one point, with Congressman Ryan and Senator Wyden out there? Is that something you'd be willing to look at?
Well, Senator Wyden has moved away from the proposal that actually came before the House of Representatives. I was the insurance commissioner in California for 8 years, and I can tell you, once you begin to divide future beneficiaries from the existing beneficiaries, the existing program will fail. And that's an actuarial fact that will happen. And it is clear in the 2012 as well as the 2011 Romney-Ryan Republican budget, and Mr. Romney has bought into the Ryan budget, that it will terminate the guarantee of Medicare for future beneficiaries, and because of the nature of insurance, the existing beneficiaries will see an immediate and ever-increasing increase in their share of the cost of Medicare. That's not my talk. That's talk by every analysis that has been done of the issue. And so what you have here is a situation in which the Medicare guarantee, which has been available to every person who turns 65, that guarantee ends. Yes, they'll be given a voucher that over time, and initially and over time, will be insufficient to pay for medical care. And let's understand, the population that's 65 and over is a population that has the highest health care cost. And so if you're given a voucher that doesn't keep pace with the cost as well as the incidence of illnesses, then you're going to find a shifting of cost from the Medicare program to the individual, as well as the situation in which that program will fail.
Let me bring Congressman Mulvaney back in for a quick response here. Final question to you. In our latest polling, when we asked who would do a better job of protecting Medicare, 45% said they went with the Obama-Biden team. 42% went with Romney-Ryan. So can the Romney team turn around those numbers?
Oh, sure. And I think you're starting to see those numbers get better as folks realize that a lot of what my colleague is telling you is designed to frighten seniors. There's only one program that protects the current seniors, which is the Republican program. The Obamacare actually impacts folks. If you're 77 years old, Obamacare changes your Medicare program. If you're 77 years old, the Ryan program does not. The Ryan program is the only one that actually preserves Medicare as it currently exists as an option. If you have to function under Obamacare, current recipients will be impacted. And I think what you're seeing in the numbers is that folks are actually reacting to the facts. They're taking the time, especially seniors, to figure out who's telling the truth. And what you heard John talk about today is attacking an old plan. Only the Romney-Ryan plan protects Medicare as we know it today.
All right, gentlemen.
Well,
Congressman Mulvaney, Congressman Garamendi, unfortunately, we are out of time. We got to leave it there. But we thank you both and hope you'll come back soon.
Thank you.